Welcome to Diman Regional High School. This is one of our last classes, and it's been a thrill for me to be able to do it. Nurse Aides is the name of the course, and you have an overflowing crowd of students here, I can see, peeking out of every doorway. Great to see you. And your name is Cynthia Barabee?
Yes, Cynthia Barabee.
And you're the department head?
I am the department head, and I'm also the senior instructor.
Okay.
And my name is Lauren Brabello. I am the freshman health assisting teacher.
Okay, you covered them all, right? You
Yes.
covered them all. Well, thank you for having us into your world. You know, we enjoyed all of the trips, all of the times that we've been through the students in Diman, and their enthusiasm is unbelievable. And you can see that this is your next, will they be doctors? Or let me ask you some questions, all right?
Absolutely.
Because I have to get the, what would be the goals of the program that you're doing?
The goal of our program is to train technically skilled healthcare workers who can go out into the healthcare industry and meet the challenges of today's healthcare needs.
Okay, when they earn a certificate, they have to earn a certificate to do that?
Yes,
Go
yes,
from
they
here?
do. Yes, they earn a nurse assistant certification in the junior year. That gives them the credentials to work to get employed as a CNA, or certified nurse aide.
As you handle freshmen, you have to work them into that program all the way up the line. Each step is important to their career future to take advantage of that, right?
Yes, and in the freshman year, they get certifications such as CPR, first aid. We do the American Red Cross babysitters training. So it's a pretty intense year for them, and it's amazing to see how the kids are so eager to learn the information.
Yeah. Amazing. You know, when you think about it, what the biggest healthcare is the biggest budget item everywhere.
Yeah.
It's the biggest budget item, I don't know, wisely spent or unwisely spent. It's an item that provides a future and a road, a path to success for the students, too.
Absolutely.
You know, a lot of people out there. How about the vision for the future? Simulation lab?
Yes, that's the the newest technology. Nursing schools in the area have simulation labs, and it's a mannequin that takes on real life characteristics, where the instructor can be the voice of the mannequin, and the student has to use critical thinking skills to assess the situation. And what's nice about it is it's in a controlled environment where a person's life is not really at risk, and they learn those vital skills that would be necessary to, intervene in a life-threatening situation. And so that's what we're hoping for in the future.
Wonderful. So that would be the more diverse clinical assessments of a patient? Is that what they're able to?
I think I would say it would kind of be like in between learning the bookwork and then taking care of a patient. You learn the technical stuff, you learn the bookwork, you get to apply it to a mannequin that gives you feedback, and then you go take care of the patient. So it gives them a whole different level of comfort with their skills and their abilities.
Also gives them an expansion of the medical technologies that are dealing with patients. They can expand, and every day is a new term for it, a new disease, a new.
Yeah, that's exactly that we were saying. It kind of keeps them up to date with 21st century technology, and that is the goal of Diman, to keep our students up to date with what's out there, so that they can meet the needs of the healthcare field.
Now, would I say that the students in this group with your leadership have been all go to employment, that they find employment quickly?
Yes, yes. In fact, we cannot keep up with the demands of our local community. I'm often getting phone calls and emails. Local employers are looking for CNAs. All of our students that wish to pursue a career as a CNA do get employment in a variety of different facilities in the local area.
Yeah, well, you look at how many nursing homes we have here.
Yes.
How many, what do we have, 2, 3 hospitals? Very close, maybe 6 within a very small region.
Yes.
And it's amazing. And it's, this is not just here. This is all of the classes that are in here. If you start thinking about what Diman's students and its teachers have added to the communities that they're in, they've, at no cost, have really been, it's an expensive proposition to ever not give Diman what it needs.
Yeah, exactly, because we have a lot of students that apply to be into our program as freshmen. I think for the past few years, every student that has been placed it's been the #1 choice that they've selected.
Yes,
Uh-huh.
it has.
Yeah,
Yep.
and we turn away students who are choosing this as their first choice program.
Wow.
So there's a great opportunity out there.
So as the school goes into 4 years, they enter, they go to all the places, they will shop. So they get a feel of all the shops, and then they eventually in their junior year or their sophomore year or the next 2 years, whatever, they get to pick the shop
In the freshman year.
in the freshman year.
Yes.
Okay, okay. And if they're lucky, they
If they're
get,
lucky and work hard.
if they're lucky,
Work
if you're lucky,
really
you
hard.
get them. See what I
Yeah.
mean? If you're lucky,
Yes.
you get them. Yeah.
Yeah, and they
Yes.
know it.
Yes.
They
But
know
they're
you.
great students. They are so self-motivated.
Yeah.
I typically think of teenagers as at home playing video games, not really interested, kind of like when I was in high school.
That was
And
last week.
Something like that. But these students, they're so vocationally minded. Like, they know their careers. They're
Yeah.
willing to do the work. If I told you how many medical terminologies they learned in like 4 months, you'd fall off your chair.
I'll bet.
Yeah.
I'll bet. You know, when we first started, we started across the hall in a dental hygienist. And one of the things that what I can't think of her name, Cynthia, she's Cynthia?
Linda Petit, maybe?
Linda
Yeah, Mrs.
or
Patine.
Yes.
I knew Mrs. Patine, mother and father. Anyway, as we got talking, she was talking about how they would like to, in building a new school,
Yeah.
and I've carried this theme ever since, is that it'd be nice if you build a school with a campus where you have your own building.
yes, that would be ideal.
That it would first of all not have any turnaways with people. I mean, your kids would apply. I mean, you get more that will apply, but you'll be able to do it. But you'll have that individual thing because you save the community a lot of money because you could do a lot of free dental work.
Yes.
And you could do, if you start looking at all the shops, you could do a lot of motor work of cars and drafting and everything else. If you had a campus like that.
You're so right.
The thing is, what would happen is this would be at the high school level. Usually, you're being sold a bill of goods at the college level, of course, but because you're setting that up, you're setting the students up for going to college, of course, and certification. But the question would be if you're building a school for and build it on a campus type of atmosphere, whereas it's conducive to paying back the community
Yes.
in many, many ways, of which, if you didn't have Diamond, it would be
Yes.
costly.
Yes. And we've even had the discussion with our administrators about the potential for, when we do have our new facility, about the potential for a clinic that would be where our students would work. And it would be a combination of the health assisting students, the dental assisting students, and the new medical assisting program that they're looking to start, which is currently in the process of going through the approval process. We're looking to perhaps pioneer that, where
Good
our
idea.
students would be able to get the care that they need and still have the learning going on, the real life learning that would accompany
And
that.
just think that a big health provider that's nationally known gets involved in the vocational schools course
Right.
and then pays for the building. Pays for the building and all the equipment you go with, then you're being expanded. You don't have your own hospital, but everybody would have their own area, and you could expand. The kids would get to have a learning experience at wherever they want to be in, and that would move into that area a lot quicker, and it would be revolutionary for.
It would.
I'll give you enough. We're talking about. We did an interview. I did an interview the other day with a former mayor, John Mitchell. Was a friend of mine. He's a commissioner for Bristol Aggie, and he was reminding me that many years ago, when I was younger and could walk better, they were going to shut down Bristol Aggie at that time, and there was myself and somebody else that saved Bristol Aggie. I know we did something. I didn't know where it saved the school. The point was that they have the highest, in this area, have the highest equestrian course in the country. And the question, they have the 18 horses. I'm trying to change the subject here, from health. But
Health to horses.
the health to horses. But the reason being, they could get more. They could get jobs training, taking care of horses, veterinarian schools. Whether you know it or not, that when racehorses pass on, their bodies, than given to Tufts Medical Center. Why? Because the lungs of a horse can take more and they're given to human bodies.
Wow.
So they never got Tufts Medical Center because they're out of the loop. You know what I mean? See what I'm saying? And you got to get in the loop
Yes.
to do it. So
Well, I
is it-
know I can tell you, Mr. Alban is very focused on giving back to the community.
Oh, yeah.
And the clinic type of ideas. We actually went to Bristol Community College yesterday to see how their health science building was set up. While we have our vision for our school, we're trying to look for many ideas, so we
Yeah, I
can
know.
kind of meet the needs of the community.
Well, I've been all over. I don't see him every day. You know,
Yeah.
I see him. I'm very good friends with him. But I always say when I pass him by to drop something off, I always say, campus,
Yes.
campus,
Yes.
make a campus. You know.
Yes.
And I said, you have to run it like you run a campaign,
Yeah.
and then you can put this across. So anyway, there's always a demand for highly skilled professionals, and you kids can get the lead into that by going to classes like this and liking it, you know.
Yeah.
And it is a nice Primacare and whatever else is you can hook up with, and but you need to get somebody who is in a combination of things, produces a particular product that's used in the industry, of which would like to put their stamp on having a campus building. That kind of thing, And the same thing you do, as I said, with all the other shops. I don't think there's a shop in here that I haven't seen that they couldn't get somebody enticed into putting a stamp on it, which then it's unfair to come after everybody else has used the consumer on a vote for a school before you get there. In other words, you know what I'm saying?
I see what you're saying.
Saying if Durfee High School, I'm a graduate of Durfee High School. Durfee High School got a new school.
Yes.
The people of Fall River voted on Durfee High School, okay? But they're gonna have to vote again for Diman.
Yes.
True.
So my question is, how do you make it? You need to start thinking of this campus type of thing
Right.
to kind of defray some of your part of that vote, okay? And the other thing is, you have no television here, all right? Now, why do I even mention that? You're in the city of Fall River, okay? Durfee has a television station. They have an assessment of $250,000 a year for a 10-year contract. So we really don't work for Comcast, but we do the access for things. I'm all over Comcast about Diman getting a television, not so much a station, just to take what we started for you on YouTube, is that you can see what you're doing and do it often if you had a station.
Yes.
You also could set up a sports network for the schools that are in the region of Diman. Athletics, all the things that go with it, gymnastics, whatever it may be, and where would you would fund Diman at the equivalent you fund Durfee. But then you do is you would get some students who maybe after school would want to learn how to get Comcast to come in here and teach you. Remember, I'm trying to get the media trapped, so so all the things I said earlier, they get in here and they do a sports program with high school sports. So when you do high school sports, you do hockey's too fast. You got to do it on robotic cameras on tracks. You go over the rink, you put it in there. Who pays for it? Comcast. Who runs it? Diman students.
Well, okay.
Who gets paid for it? Diman students. Then you want to do outdoor sports. Get outdoor sports, drones. Drones hooked up to a golf cart, up and down the sidelines. You bring the pitcher in. Who teaches you that? Here.
Wow.
Who wants to get involved in it? But it's everything. It's everything. You know what I'm saying?
That would be another
Right.
great opportunity.
Yeah.
These are good opportunities. Anyway,
Yeah.
all right, listen, I want to get off the subject here. We're going to go on. You guys aren't getting off the hook. Did you think I forgot you? No, I didn't. We thank you very much for having us. And these ideas are a little crazy, but they make a lot of sense. Because the media can be important to you
Yes.
to give the kids what they need in classes and acceptance, if you will, out in society. And also, if you have something that's like a a separate deal. It's so much more you give back to the community. Not only do you give their hearts to fulfilling their dream, you do that to the patient. All right, everybody. This is Nathan. You're quite a student here. I'm led to believe. Is that
I'm
right?
a senior.
All scholastic? Is that what it is?
The outstanding vocational student.
Wow.
Yep.
Oh, very good. Now you're a senior.
Yep.
Senior. And you have plans, I'm sure.
I do. I'm going to be going to school down in South Carolina, Charleston Southern University.
Good.
To study athletic training.
Well, that's good.
Yep.
That's good. Congratulations, Nathan.
Thank you.
All right. I gotta get. What do you think the program has prepared you for these plans?
Well, it just gives me like the experience I needed. It introduced me to like new medical terms. It allowed me to like learn the anatomy of the body. It vital signs that I'll need to use like when I'm like one-on-one with patients.
Yeah.
So it just gave me that experience that I needed.
That hands-on skill.
Right.
Get next step. Were you employed? Are you employed in a co-op program?
I am. I work at Truesdale Surgical Associates,
Okay.
right down the street,
Yeah.
in the medical records department.
Okay. Great. Great experience. What do you think, Anthony? What are we doing here? How about you? What do you think you're going to be doing?
I want to go to college to become a nurse practitioner.
Great.
So,
Big field.
Yes.
Big field.
yes, there's a lot you could go into with healthcare. So,
Yeah.
but I actually just got employed at Charlton, so I'll be working there as a food service worker, and hopefully once I graduate Diman, I could go there to be a CNA and then continue on to college. And they actually will be helping me with college. They actually they pay for some of your college. So.
Well, that's good. That's great. Alexa?
I actually plan on being an emergency room physician. So, yeah, I'm really excited about that. So I'm thinking UMass Dartmouth, maybe for classes and stuff. And there's a UMass Med School in Worcester.
Yeah.
And I was thinking of attending that after I get all my classes done and everything. But,
This is great for you here because usually admission to those, because of the broadness and the expectations of the medical field, isn't it great tough? You need this kind of training and accelerate this kind of training so you step off the blocks and you're really in front of the whole thing, you know, rather than trying to catch up. Because it's moved so fast and it changes so much, you know, that there's always a new entity, no matter what school you go to. You know, and always something being trained. So good, Alexa, you do well. Kia?
Kaya.
Kaya. All right, Kaya. And you?
I also want to be an emergency physician. I really like the adrenaline rush. I really like thinking quick on your feet. I'm really unsure about colleges. I know a lot of colleges offer this, like, different things. So I'm thinking maybe University of Rhode Island. I really want to branch out and go different places, but I'm not sure yet.
Well, no, but it's great, though. I mean, it's great that you're thinking that way, because you got to think of everything that changes, you know, and what have you in the field. My late mother is a nurse. My sister, my older sister is a nurse, was a nurse, and my younger sister was a radio technician, technology in healthcare. But the most interesting part, the most intriguing part of it is we had a cousin who came from Attleboro. She actually was a nun, okay? And she trained in the medical field, and she went to, it's an actual story. She then went into went into Belgian Congo, and she caught, she was a leper, got to be a leper. The only communication that they had with her till she passed away was the bush people who are in the country, and the radio contact. That's the only contact that she had with her family. And so, what I'm getting to is the dedication. She worked in the surgery, the rush. She worked in the surgery and the OR, and then went on to those type of things. And we saw her, I think, in 2 years, many years ago. But that was a dedication. Thank you. Thank you all. All right? You give me your autograph before I get out of here? Thank you. You all set? Huh?
Jonas, I'm just going to begin by taking your pulse, all right?
the count of three, if you could push off the bed. Ready, 1, 2, 3. You look good? And then we're gonna pivot toward the wheelchair. Reach for the armrest, and on the count of three, we're gonna take it back out. 1, 2, 3.
We have a first aid station where the student is providing care to the person who has a bleeding wound, and then going to apply a pressure bandage. Okay. And then what are you guys doing here?
Range of motion.
Okay, maybe you can do some flexion and extension.
I'll just move the foot too. That's okay. So you can do flexion and extension, the foot.
Analyzing heart rhythm. Deliver shock now. Press the orange shock delivered.
And this is Caitlin, Teresa, Willow, and Savannah, okay? The question I have is, what makes you choose this program?
Well, I wasn't interested in healthcare until I explored this program, and my favorite thing about it was seeing the upperclassmen doing what they do every day, and I thought, like, I want to be in this shop, and I want to go into a career where I can use these skills in my career and everyday life.
Good choice, big field, big field. How about you, Savannah?
Well, ever since I was, like, little, my mom's side of the family has always been, like, doctor care and all that kind of stuff, so, like, I basically grew up around it, and I was, like, really interested in being part of that career. So when I came here, I explored the shop, and that's when I, like, decided I really wanted the shop. So I, like, continued to get good grades in all the exploratory shops, and I ended up here in my first place.
Teresa?
Well, I always wanted the shop from the beginning. I think it's fascinating that by my knowledge and my skill, I can actually save a person. And I think that it's amazing to do.
Check out what a variation you have in the healthcare field, though. You know what I mean? Short of being a physician. I mean, all the opportunities you have, technician, you know, but you do have a hands-on job where you really affect lives. And it's a big field. And you know, it's highly technical as well. So all of the training that you get will have to obviously include all that. And so it's a great opportunity. Caitlin?
Well, I want to be a neurobiologist, and this was the only shop that was really close to what I wanted to do in the healthcare field. So I decided to go with this shop because it gives me more knowledge on what I want to do.
It would be nice if in your quest for a new school that they set it up whereas it'd be like a campus type of atmosphere, as I said earlier, whereas you have your own shop and you get a major health supplier paying for things and including anything you feel was left short in some of the whole plan to be healthcare workers. Diamond needs a new school. Very badly. Well, for bigger space and for you guys as freshmen, you're going to be here with that while it grows. And your input is important to making that happen. I keep selling, Mr. Orban, campus, like I call it campus, where each particular subject has its own area. I know you're doing the school, but you're limited to your space because too many people are being turned away. Other schools aren't turning away students. I mean, has to, because they don't have the space. Anything you'd like to add?
I think a new campus would be cool for the shops because everybody would have a lot more space to work, and we could have room for more equipment. So not just for this shop, but for every shop in the school, it would have more opportunities if we had a bigger campus.
Exactly. exactly. You get a broader, I mean, there's no question that the facility, of the faculty rather, at Diamond has tried to handle every subject that they believe is out there, that they can train people for. I did a little skit with down at the auto shop about welders, and I do a show called Veterans Corner, and I talk to different veterans. We go to nursing homes. We talk to veterans who served in different wars and what have you. The stories are amazing, and I went to them and asked them about what's the quest for welders, and they come up on the Navy computer, and I got applications from them to apply to be a welder at in Connecticut, building submarines. Now, do anybody take part in it? No, but it's there. But it's there to be taken if you want to do it, just like this, very much so. Well, kids, thanks a lot. And I know we'll all get a new school, and you'll be big on it. You'll be big on campus, all of you. Okay, thank you.
Thank you.
Thank you.